The Conversations on Health Equity online video series is produced by the Health Policy Research Consortium, funded by the National Institute of Minority Health and Health Disparities. Located in Greenbelt, Maryland, under the leadership of our principal investigator, Kwesi Nfume, HPRC conducts policy research on issues related to health inequities throughout the country with a focus on the Mid-Atlantic region. HPRC uses a transdisciplinary research approach to close the gap between policy and science by assessing how current and proposed policies affect various populations. Major research efforts underway include the Health Policy Literacy Study, the Policy Portal, various research papers focusing on behavioral and social sciences, and a cardiovascular disease study focusing on disadvantage in the food, built, and social environment. For more information, visit our website or our social media channels.
Hello, I'm John Sankofa. Welcome to Conversations on Health Equity. We continue our important dialogue about cancer and the Latino community with Dr. Elmer Huerta, the director of the Cancer Preventorium. Dr. Huerta, thank you for continuing this important dialogue with us.
Absolutely, John. Thank you very much.
I wanted to pick up on something that I know is dear to your heart, and that's the topic of health communications and health education for the Latino community. I know that you're the president of Prevención, and you're doing some incredibly important work with your leadership there. Can you tell me, why is education and health communication so important, such an important part of the health conversation for Latino communities?
Maybe I should share with you and the viewers the reason why I started this, the health education component of my life. I'm a medical oncologist by training, and I'm from Peru, and I used to give chemotherapy to patients. After working maybe 8 years in this field, I realized that all my patients were dying. You know why? Because they have so much advanced a condition when they came over. Breast cancer were huge, colorectal cancer were advanced. My chemotherapy was not working. And one day I met a woman. She was in the stretcher in a puddle of blood right there. And then I said, why didn't you do a pap smear before? And she said, what is that? I said, don't you know what a pap smear is? And she said, oh yeah, isn't that the thing you do in the throat to diagnose infections? She didn't know. But the same woman, when I was examining her, and I asked her, have you watched the last episode of Simplemente Maria, a very famous soap opera at that time in Peru?
A novela.
She knew it by heart, the novela. That's what I said. Why is that people know so much about entertainment, sports, and so little about health? And then I said, well, it's maybe because the media are bombarding these communities only with entertainment messages and sports or whatever. And there's this relative lack of health education in the media. And I started to do radio, I started to do television, and pretty soon I quit from medical oncology. I came to the US to pursue a career in cancer prevention and control. And when I came to the US, I started to do radio shows. The population, they were so eager to listen messages that I thought that my career was in the right track. In other words, I thought that by providing this information to people, opening their eyes, increasing their awareness, I would be able to move them from inaction to action. So I started a clinic, a low-cost clinic at the MedStar Washington Hospital Center. I call it the Cancer Preventorium.
This is in Washington, D.C.?
In Washington, D.C. So there, we have a sign at the door that says, this place is for people without symptoms only. And people go there without symptoms. 85% of my patients, they have no symptoms at all. And 85% of these people have no health insurance. Why do they go? Because now, thanks to the radio programs and the television programs, they know that prevention is important. And if they want to have a good life in the United States, they need to be healthy. That's why they pay out of pocket to go to this clinic. So health education is important because it is only when you provide education to people, then you find something that they are going to react. That's one side of the coin. The other side of the coin is in my hospital too. John, a couple of years ago, I asked my database people at the hospital to give me the list of all the advanced cases of breast cancer.
And this is at MedStar?
At MedStar Washington
Washington
Hospital Center at the heart of Washington, D.C. She gave me a list, and you know what? We found that in my hospital, in Washington, D.C., in the nation's capital, we have doubled the national rate of advanced breast cancer, stage 3-4. In nationwide, it's less than 10%. At my hospital, 22% of women who go there have stage 3-4 advanced breast cancer. So we went to see who these women were. We were expected to find lack of insurance, lack of education, but you know what? These women live around the hospital. And you know what? 97% of them, they do have health insurance in their pockets. What is the problem? Lack of education. So you have one side of the coin. Latinos who are poor, uninsured, going and paying out of pocket for prevention without symptoms. And the other side of the coin, women who live around the hospital, American, African-American ladies with insurance in their pockets, going late.
So when we think about this education then and focused on prevention, it seems like awareness, just awareness alone is an important part to understand what risks are present and what you can do about it. I'm thinking of the term health literacy also, because I heard you describe the pap smear and how a woman did not understand fully what that was. How do you think about health literacy in the work that you do at Prevención? Are you helping people to sort of define these important medical terms that are out there?
Right.
What involves?
Right. I think go hand by hand. If you give programs that are to increase their awareness about conditions, HIV, heart disease, or cancer, or anything, but you take into consideration the educational level of your target population, then you do health literacy the right way. For example, in my case, when I talk about cancer, I cannot use scientific words because most of my listeners, and I have data on this, at least for my patients, 50% of them have not finished elementary school. So I need to talk at their level. That is health literacy. Because if I use scientific words or my language is too high, I'm going to miss all these people.
So tailored to the listener.
Exactly.
Yeah.
Health literacy means that you choose the educational message and you shape it in such a way that people are going to understand you. That is the health literacy component of health education.
Now, Dr. Huerta, I have to ask you this too. We talked about, in our last segment, we talked about cultural competency in healthcare. I wonder if the same term applies to health education, that you have to have this sort of cultural sensitivity to the kind of information that you're creating. Not just the right language, but also is there some cultural nuances that you need to think about when you're developing this educational and awareness material? Is that right?
Absolutely. Absolutely, John. That's very important. Cultural competence and the messenger is extremely important. For example, when I speak in Spanish to my listeners, I am an immigrant myself. So I have the luxury of talking to them, and I can choose some words that other listeners may find harsh. For example, I tell my listeners, listen on my microphone. If you want to have a good life in America and you want to really succeed in this country, you better make sure that you are healthy. Because it will be a shame if you, later on, you find that you have a cancer that could have been prevented or a heart attack that could have been prevented. In that case, you have failed to your family, to yourself. That's harsh. But because I am an immigrant, like them,
it's well received.
They respect what I say, and it's well received. In this project I told you at the Washington Hospital Center, in the Ward 5 community around the hospital, we want to do the same, but definitely I will not be the messenger. I need to find a health provider, probably a doctor that is an African-American person who can talk to them in their language, in their cultural nuances, so they can relate to the message.
So the message and the messenger
Extremely
are
important to be hand to hand.
So I want to talk also about diversity. We spoke about cultural competence in healthcare delivery and education. Diversity is something else. It says that the folks who are there at the table, who are providing the services, need to reflect the population that's being served. How does that play out in the Latino community? Why is diversity important among healthcare providers, among health educators, even among researchers? Can you talk to me about that?
Yes, I think diversity is extremely important. I remember my times when I was at the National Cancer Advisory Board, and I was the only Latino person there. Every time they presented these very important projects at the National Cancer Institute, I would just raise my hand and say, what is the Latino component in this project? And that is the diversity, because I was one of those people, or the only Latino at that table. I would make sure that issues that pertain to the Latino community were on the table. But in terms of health, if a person goes to a hospital and some of the doctors are like him or her, they speak the language, they're sympathetic to their culture, the person says, okay, that place is diverse. There are people like me. So in science, it's very important. If we do clinical trial, for example, and we include people who are African American, who are Asian, who are Latinos, we will test a medication or a combination of medication or whatever in people from different backgrounds, and we may find out different conclusions. So diversity is extremely important. In our country here in the United States, I think diversity has been the key to success, because when you have more diverse people, you have diverse ideas, and then you have diverse outcomes.
Dr. Huerta, as you look back across the decades of the work that you've done around cancer and around supporting the Latino population in particular, I'm wondering, what are the biggest lessons that emerge from that for you? Is it around cultural competence? Is it around access? What are the biggest things that you see?
I have learned all these almost 30 years plus of doing this is that people, they are very interested in their health. They are extremely interested, and they are eager to get information about their health. They are really thirsty for health information. That's number one. Number two is that if you provide that information that they really want in a language they can understand, you can move people from inaction to action. I think that is extremely important. That's what I have learned. My work over all these years that has shown me that people are really interested in their health.
So you've done so much important work as an oncologist, as a culturally competent medical educator, as a talk show host, as a TV a medical correspondent for CNN. What's in the future for you? If you looked at the crystal ball and you thought about the work that you have yet to do or that you want to continue doing, what would that be?
I love to write. I just published 3 books. My 3rd book came out last year, and I intend to keep publishing. I love publishing. I love writing. I think that's one area I would like to develop. And I love radio more than television. And I want to keep doing radio. And now it's amazing. With technology, I can produce, I can broadcast a whole radio show, for example, from the United States to any country in Latin America with a telephone. So with a microphone, internet connection, and a telephone, I can broadcast a show, FM quality sound to anywhere. So maybe if I retire someday, I would love to keep doing radio and writing my books.
Dr. Huerta, you are the messenger with the message and the oncologist. Thank you so much for your time and for your insights. Thank you for joining Conversations on Health Equity. To learn more about future programs, visit our website at www.hprc.info.